Brad Williams, Frugal Finance, Medicare. Understanding Medicare, breaking down the essentials. Medicare is a federal health insurance program primarily for those age 65 and older. It also covers younger individuals with specific disabilities or medical conditions such as end-stage renal disease. As you reach 65, or if you're helping someone else navigate Medicare, it's crucial to grasp the difference between the four parts of the program: Part A, Part B, Part C, and Part D. Each part covers distinct services. Choosing the right coverage can make a significant difference in your health care. When does Medicare enrollment begin? At 65, you're eligible for Medicare. If you're already receiving Social Security benefits, you'll be automatically enrolled in Medicare Part A and Part B the month you turn 65. And you'll receive your Medicare card in the mail. For individuals with disabilities, enrollment occurs after 24 months of receiving Social Security disability insurance. Key points about Medicare. Medicare provides health insurance to people 65 or older, younger people with disabilities, and those with end-stage renal disease. Part A covers hospital care, skilled nursing care, hospice, and some home health care services. Part B provides coverage for outpatient services, including doctor visits, lab tests, and medical equipment. Part D is an optional prescription drug benefit. And Part C, Medicare Advantage, is a private insurance alternative that bundles Parts A, B, and D, often including extra benefits. In 2024, Medicare served over 67 million people. Medicare Part A, hospital inpatient care. Part A is the hospital insurance component of Medicare. It covers inpatient care, such as hospital stays, skilled nursing facility care, hospice, and home health care. If you or your spouse have worked and paid Medicare taxes for at least 10 years, you typically won't have to pay a premium for Part A. However, if you haven't met this requirement, 2025 monthly premium for Part A will range from $285 to $518 a month, depending on your work history. For inpatient care, you must meet a deductible of $1,676 in 2025, and Part A covers the first 60 days of hospitalization. After 60 days, you'll face copayment, and after 150 days, you're responsible for all additional costs. It's worth noting that hospice care must be coordinated through a Medicare-approved provider. Medicare Part B, outpatient and preventative services. Medicare Part B is focused on outpatient care, including doctor visits, lab tests, and medical equipment. It also covers preventative services like vaccinations, screening for chronic conditions, and mental health services. For 2025, the monthly premium for Part B will be $185 for individuals earning $103,000 or less, or $206,000 for married couples. This premium is deducted directly from your Social Security benefits. Part B comes with an annual deductible of $257. Once met, you'll pay 20% of covered services, which can add up as there's no cap on out-of-pocket costs. A significant financial concern for some beneficiaries, particularly those facing serious illness, is the high out-of-pocket expense. What Part A and Part B don't cover. Medicare Part A and B cover a wide range of services. There are notable exclusions such as long-term care in nursing homes or assisted living facilities, routine dental and vision care, hearing aids. For long-term care, Medicare doesn't provide coverage, and many people seek out supplemental insurance to help with these costs. Financial advisors often recommend looking into long-term care insurance as a supplement, as Medicare is not designed to cover these extended needs. Medicare Part C. Medicare Advantage. Medicare Advantage, or Part C, is an alternative to the original Medicare plan. It's offered by private insurers approved by Medicare and combine coverage from Part A, Part B, and usually Part D prescription drugs. Medicare Advantage plans may also include extra services like dental, vision, and hearing care, which aren't covered by original Medicare. While you'll still pay the Part B premium, some Medicare Advantage plans may come with an additional premium. These plans also often have a more restrictive network of healthcare providers. Trade-off is that they can offer additional benefits, may be more affordable than traditional Medicare, depending on the specific plan. Medicare Part D, prescription drug coverage. Part D provides a prescription drug coverage through private insurance companies. While many Medicare Advantage plans include Part D, you can also purchase standalone Part D plans if you have original Medicare. These plans have annual deductibles and copays for prescription medication. Part D includes a coverage gap, often referred to as the donut hole. After you and your plan spend a certain amount on drugs, it's $2,000 now in 2025, you enter the donut hole and pay a higher percentage for medication until you reach the catastrophic coverage threshold where costs significantly drop. Starting in 2025, the donut hole will be reduced and out-of-pocket expenses for prescriptions will be limited to $2,000. Supplementing Medicare, Medigap versus Medicare Advantage. Medicare Advantage Part C is one option for expanding coverage, but if you have original Medicare Parts A and B, you might consider Medigap, also known as Medicare Supplement Insurance. Medigap helps cover the costs that original Medicare doesn't, such as copays, deductibles, and coinsurance. Medigap policies are standardized by the federal government but are sold by private insurance companies. Note that you must have Part A and B to purchase a Medigap plan, and each person must buy their own policy. Spouses cannot share coverage. Will Medicare cover all healthcare needs? Well, Medicare provides essential coverage for many healthcare services, not all inclusive. It won't cover long-term care, dental exams, vision tests, or hearing aids, among the other services. To fill these gaps, many people opt for Medicare Advantage or Medigap coverage. Conclusion: Medicare is an essential program that offers vital health care coverage for older adults and those with specific health conditions. Understanding the 4 parts, A, B, C, and D, is crucial for selecting the right plans to meet your needs. Whether you choose original Medicare with Medigap policy or Medicare Advantage, it's important to weigh your options and plan ahead for any gaps in coverage. Take a look at the many Medicare-related videos I have. Just check out my playlist under Medicare. Comment if you have any questions as it relates to this specific topic. Brad Williams, Frugal Finance. Thanks for watching. Hope that helped. See you soon.